My name is Julie Byler. I'm an internist and addiction medicine physician at Beth Israel Deaconess Medical Center in Boston, Massachusetts, where I attend on their inpatient addiction medicine consult service. Today, I'm going to be talking to you about the Sinclair Method, a naltrexone protocol to reduce alcohol use. The Sinclair Method is a structured, off-label approach to treating alcohol use disorder that involves taking naltrexone, an opioid receptor antagonist that is FDA-approved for alcohol use disorder, before consuming alcohol. Unlike traditional daily naltrexone use, which may be started after a period of alcohol abstinence or detoxification, the Sinclair Method can be used when individuals are still drinking, with the goal to help control or cut down on their alcohol use. In the Sinclair Method, naltrexone is taken on days the patient plans to drink, which could be every day. Naltrexone blocks opioid receptors, dampening the brain's release of endogenous opioids, which causes the rewarding response to alcohol use. This process, known as pharmacologic extinction, diminishes alcohol's reinforcing properties and can lead to reduced drinking over time. This protocol can be considered in patients that are diagnosed with alcohol use disorder, interested in reducing their alcohol use, but not necessarily ready for immediate abstinence, not currently using opioids, which is a contraindication to naltrexone, and that are able to self-manage medication timing and adherence. Advantages of the Sinclair Method are that it supports risk mitigation and non-abstinence-based goals. It offers an alternative for patients not interested in traditional daily dosing. It empowers patient autonomy, and it allows for increased flexibility and individualized dosing. There are some limitations and considerations to think about before using this protocol. It requires consistent adherence to the protocol to be effective. Patients must be able to anticipate and plan for drinking occasions, which not all can. Lastly, the risk of alcohol withdrawal still exists and should always be considered. Mild withdrawal may be managed in the outpatient setting during the protocol, but patients at risk for severe withdrawal may not be appropriate candidates. This table compares the Sinclair Method to traditional naltrexone use and targeted naltrexone dosing. You can see for treatment goal, traditional naltrexone use is typically abstinence, whereas in the Sinclair Method, the goal is gradual reduction in alcohol consumption over time. The goal of targeted naltrexone dosing, on the other hand, is to reduce cravings or heavy drinking in high-risk situations. In terms of timing of dose, in traditional naltrexone use, patients take naltrexone daily or monthly with the extended release injection, regardless of their plans to drink or not. In the Sinclair Method, the timing of the dose depends on the patient's alcohol use patterns. It could be daily if the patients are drinking daily, or it could not be, depending on what their patterns are. In targeted naltrexone dosing, naltrexone is only taken before anticipated high-risk situations where alcohol cravings are anticipated. For example, a family occasion or a party. The mechanism emphasized in each of these protocols is also different. In traditional naltrexone use, the mechanism is to block reward pathways to reduce cravings and prevent return to use. In the Sinclair Method, pharmacologic extinction is emphasized. Pairing alcohol use with naltrexone weakens the alcohol reward association, leading to decreased drinking over time. In targeted naltrexone dosing, on the other hand, the mechanism is to block the reward pathways during these high-risk periods to reduce cravings or prevent use. Traditional naltrexone use has a fixed daily or, as mentioned, monthly dosing schedule. The Sinclair Method, however, allows flexibility and customization, where naltrexone is taken only on days the patient plans to consume alcohol. Targeted naltrexone dosing also allows for flexibility and customization of dosing, just in a different manner, where patients start taking naltrexone 1 to 3 days before high-risk situations. Now let's walk through some details of the protocol. Before starting, patients should have an initial assessment where their current alcohol use and withdrawal risk is evaluated. Remember, patients at moderate to severe risk may not be suitable. Next, work with the patient to develop a personalized plan based on their drinking habits and goals. Instruct patients to take 50 milligrams of naltrexone on days they plan to drink. If concerned about side effects, you can start at 25 milligrams instead for the first week. Follow up with the patient regularly to monitor for any side effects and for withdrawal symptoms. Consider outpatient management of withdrawal if it's mild, but refer to a higher level of care for more severe withdrawal. Here you can see an example protocol. Note that, as I mentioned, the protocol can and should be individualized, So this is just one example. In this protocol, you start with an initial assessment of the patient's baseline alcohol use, as mentioned previously. At this point, the patient will not be taking any naltrexone. In week 1, on days 1 through 7, in this protocol, the patient's goal is to reduce how much they are drinking by 1 drink each drinking day. They're going to take 50 milligrams of naltrexone on the days they plan to drink. In the second week, the patient's goal is to reduce how much they're drinking by 2 to 3 drinks each drinking day. Again, they're going to continue at the same dose, taking 50 milligrams of naltrexone on the days they plan to drink. Note that throughout the protocol, you should be checking in with the patient regularly and monitoring closely for any signs of alcohol withdrawal or side effects. As the protocol progresses, you can see that the patient's goal is to continue to reduce how much they're drinking each drinking day. As you proceed, you should be continuously checking in with the patient to assess their response and modify the regimen as needed. You can see that if the dose isn't working, you can consider increasing to 100 milligrams if you and the patient feel like there has been an inadequate response. When choosing to utilize the Sinclair method, it should be noted that high-quality evidence on the Sinclair method is limited, with no large randomized controlled trials to date. Daily naltrexone has strong evidence from trials like the COMBINE study, a 16-week study of 952 participants with alcohol use disorder, which showed that daily naltrexone led to a higher percentage of abstinence days and a reduced risk of heavy alcohol use compared to placebo or medical management alone. In summary, the Sinclair method is a structured, off-label protocol that uses naltrexone to support gradual alcohol reduction over time. It may be beneficial for motivated, self-directed patients who want to reduce their alcohol use over time, but may not be ready for full abstinence immediately. Naltrexone is taken only on drinking days, which could be daily, blocking the brain's reward response to alcohol and weakening alcohol's reinforcing effects over time. While the available evidence is limited, it suggests that the Sinclair method may lead to meaningful reductions in alcohol consumption in select patients.